Hi, I'm Dr. Martha Grogan, and I'm a cardiologist, and I'd like to discuss a little bit with you about a condition called cardiac amyloidosis. And in a previous segment, we talked about what is amyloid and what are the major types that affect the heart. And now I thought we'd break this segment up into what are the tests that we use to actually diagnose cardiac amyloid and to assess the heart after a person has undergone treatment. So the two most common tests that we use are the echocardiogram, which is a sound wave test of your heart, and a heart MRI scan. Both of those two tests are sometimes the first clue that a patient has amyloidosis. So from those tests, you'll hear a lot of different terms, and it can be confusing, and patients are always wanting to know, is my heart getting any better? So we'll talk about what some of those are. So when the heart is infiltrated with amyloid, the walls of the heart, particularly the lower chambers, become thicker. And the wall thickness, when we see that the heart walls are increased and there's not any other explanation, a person doesn't have uncontrolled high blood pressure or other conditions, then that's actually one of the clues that a person might have amyloidosis. However, it can be a little difficult to measure the walls real precisely. So the main thing I wanted to caution you about is, although it's a great test when we're first making the diagnosis, very small changes in the wall thicknesses are not necessarily something that we can use to follow your heart's response to treatment. Another number that you hear a lot about is ejection fraction, also called EF. And this is actually something that a lot of people get confused about. Even a lot of doctors sometimes think that ejection fraction is maybe more important than it really is. Well, what is it? When your heart is pumping, it always has some blood in it. So your heart pumps blood to your body and then it relaxes and fills with blood again. But there's always blood still in your heart. It's like most pumps, it needs to still stay primed. So the ejection fraction is just the percentage of blood that leaves your heart with every heartbeat. So it's really important to know that a normal ejection fraction is not 100%. The heart never empties completely. Normal is about 55% or a little more than half. And often in cardiac amyloid, the actual ejection fraction number is normal, even though the heart muscle may not function normally at all. So some patients and doctors will focus on this ejection fraction number a little bit too much. But what we really want to know when we think about ejection fraction is, what range is it? Is it down in the 20% range? Is it 35%? Or is it 55% or more? So most of the time, that number is actually not real important in cardiac amyloidosis. Another thing that we can measure by echocardiogram is what's called diastolic function. That's a measure of how stiff is your heart, how well is your heart functioning. And that there are some numbers that most of the time only cardiologists are really going to understand those. So you probably won't hear those too often, but that is another technique that we use to assess how severely your heart is affected by amyloid. There's another technique called strain imaging that we also measure by echocardiogram. And it tells us in more detail how much the muscle fibers of your heart are actually shortening. So we look at certain parts of the heart and how much is the fiber actually shortening and contracting. And that's really a better assessment of heart function than ejection fraction in cardiac amyloidosis. But it's a very specialized test, and it's not really widely available. So again, it's helpful as a clue to diagnosis, and over quite a period of time, it might improve if your heart improves, but small differences are hard to measure. And then there are some blood tests that are really quite helpful in patients who have cardiac amyloid, and we use these blood tests for other purposes too. But the first one I'll talk about is called NT-proBNP, or you might just hear the term BNP. And it's a little bit of a misnomer because this was something that was first discovered in the brain, but most of the time this actually comes from the heart. So it's a substance that's in your blood, and it's released when your heart is under stress. So when pressure builds up because your heart isn't functioning properly, BNP will go up. So for this test, higher is bad and a lower number is better. But it's really important to know, what is your own baseline level of BNP, because everyone is different. So the absolute number is not necessarily so important, but what's important is what happens to your BNP level over time. So if you're being treated for cardiac amyloid, so for example, a patient with AL type of amyloid, we're looking at that trend. Where was your BNP when we first saw you, and where is it now? Is it coming down? And it's the big changes that make a difference. Has it gone down by 50% or more? Little changes usually don't necessarily mean a whole lot. Another blood test that is helpful is what's called troponin, and that's a substance that's released into your bloodstream when your heart is affected by amyloid. But it's usually a test that we actually use to diagnose heart attack. And if you have cardiac amyloid and your troponin is elevated, it's just important to know that it's not a sign of heart attack in you. It's just a sign that your heart is under stress due to amyloid infiltration. So the heart is actually really very complicated, and I haven't even told you all the complicated things about your heart, except for to make the point that there's really not one single test to tell you how your heart is doing. And you really do need someone who understands the tests to help interpret them for you, and particularly all the various images that we have in cardiology. And if you have cardiac amyloid, you really want to make sure that you have someone who understands those tests to help you make sense of them. And sometimes I kid the hematologist a little bit. They always focus on things that are numbers because they have things like hemoglobin. It's a simple number. Well, in cardiology, we don't have one simple number to kind of tell us how the heart is doing. But another thing is that, of course, if your heart is involved with amyloid, it's very scary. And so patients and their doctors really want to know how the heart is doing. And once we've made the diagnosis of amyloid, taking a lot of frequent pictures as far as a follow-up echocardiogram or an MRI really doesn't help us that much. The blood tests are important, but one thing that you might be surprised to learn is that really the best indicator of how your heart is doing is really pretty simple, and that's how you feel. So are you short of breath? Are you more short of breath than before? Or are you getting better? Are you having chest pain? Are you having heart rhythm problems? Is fluid building up? How far you can walk? All those things are really things that you can tell. So most of the time when I see a patient, they themselves can pretty much tell me if their heart is getting better. And that's sometimes as important as all the various other tests that we might do. So hopefully that helps you a little bit understand what are these tests. They are important, but there's not one single indicator of how severely your heart is affected by cardiac amyloidosis.